Munchausen syndrome. Today on BOYT we give you lesson in Munchausen syndrome. Summary. Munchausen syndrome is a mental disorder which the patient fakes illness to gain attention and sympathy. This can result in doctors providing unnecessary treatment, including surgery. Munchausen syndrome is difficult to diagnose because I've suddenly changed voice, but it doesn't matter because many other conditions need to be ruled out first. It is also hard to diagnose because people with the condition tend to see many doctors, so their pattern of behavior is hard to detect. Treatment aims to manage rather than cure the condition and is rarely successful. Munchausen syndrome, also known as fastidious. Can you come over and say that for me, because I can't say fastidious. Fastidious, fuck it. It's a disorder anyway, don't worry about it. It's a rare type of mental disorder which, in a person, sometimes fakes illness. The person may lie about symptoms, make themselves appear sick, or make themselves purposely unwell. This type of mental disorder is most often seen in young adults and old women. It is considered a type of self-harm. A person with Munchausen syndrome can be very convincing, which can result in doctors providing unnecessary treatment, such as medication or surgery even. A person with Munchausen syndrome doesn't pretend to be ill for personal gain normally, but, in search of prescription medications or money, that can come along just due to the fact that people sympathize with them. They have a very strong desire for attention and sympathy. I'm sure you know some of these people on YouTube. Often people with Munchausen syndrome have experienced a childhood trauma. A person with Munchausen syndrome gains intense satisfaction from the attention associated with playing the ill patient or victim. Signs and symptoms that may suggest Munchausen syndrome include a spectacular medical history that includes large numbers of tests, medical procedures, and surgery. An odd collection of seemingly unrelated symptoms can also be around. A lack of conclusive results despite intense medical investigations. New symptoms that appear after medical tests prove negative. Extensive medical knowledge of many different illnesses. Frequented by many doctors, sometimes in other states or territories. Presenting at emergency departments, usually in different hospitals. And they also request for invasive medical procedures or surgeries. Failure to improve despite medical treatment, including relapses for unknown reasons. Common presentations of Munchausen syndrome that you may spot. A person with Munchausen syndrome may convince doctors in many ways. For example, they may pretend to be in pain, exaggerate symptoms, fake symptoms including psychological disorders, poison themselves with chemicals or medications, infect themselves with unclean substances. They may tamper with diagnostic tests, for example, contaminate a urine sample with blood or sugar, interfere with medical condition so that the recovery isn't possible, for example, repeatedly open a contaminated wound and continuing the infection. It's rather sad, really. But anyway, in conclusion, if you on YouTube have spotted some of these people, be aware that they're not only after your sympathy and your attention, they sometimes garnish money from you. So, if you do see somebody with Munchausen syndrome, flee, go elsewhere. Thank you for listening to BOYT. Public announcements.